Okay, we will start in another 2-3 minutes, just to allow more participants to come, and then we can formally start. Okay, so it's a real pleasure for me to open the conference on digital governance in the times of COVID-19. The conference was supposed to be hosted at Bar-Ilan Law Faculty in Israel, but due to the COVID-19 pandemic, we have to host it virtually online, but this is nonetheless our pleasures, and this allows us to really have much more participants than originally we hoped to. The conference is hosted by the Jean Monnet DGov Excellence Center, in which Bar-Ilan Law Faculty is partners together with Erasmus University at Rotterdam and the Leeds Law School. And it is also hosted by BIU LawData Lab, which is headed by Itai Bar-Simantov. And this conference is part of our long-term interest in the intersection of data science and law. It is part of a long-term cooperation between the law school and the Data Science Institute at Bar-Ilan. And it reflects really the way we think legal research and legal practice are going to change in the next decade. And indeed, this conference is part of this long-term exploration. And as you will see, we will touch during the 2 days of the conference various aspects of this research, which brings together both empirical questions and ethical questions, which really the corona crisis has brought to the center. Before we go ahead with the panel, I want to say several thanks to colleagues both from Rotterdam and Leeds and here at Bar-Ilan. So first to my co-director of the Jean Monnet Excellence Center, Pinar Ackman from Leeds, and Klaus Heine from Erasmus Law School in Rotterdam. It was a real pleasure to work with both of them and with other colleagues in Erasmus and in Leeds. And our hope is to be able to see them, to meet them in person and not just virtually. Here at Bar-Ilan, thanks to Dr. Itai Bar-Simantov, which heads our lab, and Dr. Ayelet Sela, and also to Karen Limor and Aviva Fish, who helped us with the organization. One last comment is to mention another conference which will be hosted by the Rotterdam group. Let's see if I can share. It is the Ethical AI Perspective on Law, Regulations and Policy, which will be held in 29 and 30 March 2021. And I think this would also be a very interesting event, and hopefully at least part of you we will be able to see in that event, which will also be virtual. This concludes my very short introductory comments, and we can now move to our first panel, which deals with algorithmic regulation and digital policy tools during COVID-19. And this is a very interesting panel, and I can tell you that I've been working a bit on algorithmic regulation as part of a submission of a grant to the current EU cycle, and I've witnessed a real explosion of research on this area. I think it's one of the most vibrant areas of research, bringing together researchers from law, computer science, political science, and much more. And I think this would be a fascinating panel. And our first speaker is Professor Iris Eisenberger from University of Graz. And it is really especially great to have Professor Eisenberger at our panel, because we just concluded an exchange agreement with Graz, and this is one of the first fruits of this agreement. Professor Eisenberg is a professor of public law and European economic law, and the research focuses on technology law, public economic law, and the protection of fundamental and human rights. And she also heads the law and technology cluster at Graz. So Professor Eisenberger, the floor is yours.
Thank you very much. I'm trying to upload my slides. If it doesn't work, I just want to see if it works. Can you see it now?
Yeah.
Unfortunately, I cannot see it. Okay. So I cannot see it. I hope, let me just try. If I do the, no, I'm not quite sure how to get to the next slide.
We see it.
You see it, but I can't, so I can't change. No, I can't. Can you see the second slide if I do that? Okay, great. Thank you very much. So, Oren, thank you very much for this very friendly introduction and for having me here. I certainly would rather be in Israel than doing this from my office here in Graz in Austria. Nevertheless, I'm very happy for this interesting conference and for the interesting topics that will come today and tomorrow. So my talk will be centered around statistical modeling during the COVID-19 pandemic and on the human rights requirements for the usage of such models. In this talk, I'm not going to be talking about the manifold human rights interferences that we have witnessed globally. Others will be talking about that. I will focus on positive obligations under the European Convention on Human Rights and the questions what the existing case law means for the usage of statistical modeling during crisis scenarios. By doing so, I'm drawing from work that my team and I are conducting under the research grant Reason, where we study legal requirements for statistical modeling. So in my talk, I will say a bit about statistical modeling and questions that we should have in mind when using them to justify all kinds of restrictions, such as lockdowns. I will then turn to the relevant case law of the European Court of Human Rights before saying something about how we could regulate the usage of statistical modeling, drawing from examples we can find in European Union law in areas such as the financial market, climate protection, or animal disease law. So when we speak about statistical modeling and the COVID-19 crisis, we speak about usually about complexity researchers that create mathematical models for COVID-19 infection spread predictions. And there are different models that are used. Two of the most frequent ones are agent-based and state-based models. What are agent-based models? It means that the model focuses on many small units, agent, for instance, human beings, and calculates how a system of agents reacts if they have behave in a certain way. For instance, if new measures are adopted. The state-based models focuses less on the behavior of agents and more on putting variables describing the state of the system into a mathematical equation. They work with certain assumptions, for instance, that the legal measures taken are indeed effective to reduce social contacts and are dependent on a reliable data source. So what questions should we keep in mind when talking about statistical modeling and the COVID-19 crisis? First of all, yes?
I just a small interruption. This is a webinar, so for the audience, please, if you have any questions, please send us on the Q&A, and I will ask Iris when she concludes her presentation.
Thank you. So one of the first questions we should keep in mind is who collects the data. Usually problems arrive when private actors provide the basis for state action. Everyone here knows who Palantir is. In Austria, it's the Red Cross that collects data, and there have been a lot of questions around who collects the data. Second question is whose data is and is not collected. Problems arise if data set is not representative, test barriers in case of existential fears, tests in certain institutions may not be politically opportune, for instance, refugee homes or prisons or the like. The third question is who creates the models? Here again, problems arise when private actors provide the basis for state action. And then finally, how are the models created? Here, problems arise if methods are intransparent. When we take a look at the Austrian case, with regard to the question who collects the data, usually clear statutory rules apply. With regard to the question whose data is collected, statutory rules apply, but no quality requirements regarding representativeness. Who creates the models? It's public, but not institutionalized, and there's no legal basis for this. And how are the models created? If at all public, the information we get is very superficial information, and there's no legal basis. This brings me already to the human rights requirements under the European Convention of Human Rights with regard to state obligations. And important is here the right to life, Article 2, and the right to respect for private and family life, Article 8, European Convention on Human Rights. And there are a number of cases, and the most important ones are Budayeva and others versus Russia, Öner Yildiz versus Turkey, Osman versus the UK, and Hatton and others versus the UK. And what can we take from these cases for positive obligations with regards to statistical modeling in crisis scenarios such as COVID-19? So Article 2 does not solely concern death resulting from the use of force by agents of the state, but also lays down a positive obligation on states to take appropriate steps to safeguard the lives of those within their jurisdiction. And there are further references to positive obligations. This positive obligation entails above all primary duty on the state to put in place a legislative and administrative framework designed to provide effective deterrence against threats to the right to life. And further, this obligation must be construed as applying in the context of any activity, whether public or not, in which the right to life may be at stake. So there's no question there that there are positive obligations for the states to act, but it's not quite clear how they have to act. So there's a wide scope of appreciation. The court says the state must be allowed a wide margin of appreciation, particularly in cases where there are difficult social and technical spheres. So no question that we have difficult social and technical spheres here and a wide margin of appreciation. The court also says something with regard to preventive obligations regarding risks. Article 2 of the convention may also imply in certain well-defined circumstances a positive obligation on the authorities to take preventive operational measures to protect an individual whose life is at risk from the criminal acts of another individual. It is sufficient for an applicant to show that the authorities did not do all that could be reasonably expected of them to avoid a real and immediate risk to life of which they have or ought to have knowledge. So from these cases, one could say it might not be a state obligation to use modeling, but of course, certain risk prevention measures have to be taken. Could be modeling, statistical modeling. Which measures? Here again, there are some references in the court cases. This obligation indisputably applies in the particular context of dangerous activities where in addition, special emphasis must be placed on regulations geared to the special features of the activity in question, particularly with regard to the level of the potential risk to human lives. They must govern the licensing, setting up, operation, security, and supervision of the activity and must make it compulsory for all those concerned to take practical measures to ensure the effective protection of citizens whose lives might be endangered by the inherent risks. So here again, the court makes it quite clear that measures have to be taken. There can also be found some reference with regard to evaluation obligations. Here the court in Hatton says a governmental decision-making process concerning complex issues of environmental and economic policy must necessarily involve appropriate investigations and studies in order to allow them to strike a fair balance between the various conflicting interests at stake. However, this does not mean that decisions can only be taken if comprehensive and measurable data are available in relation to each and every aspect of the matter to be decided. In this respect, it is relevant that the authorities have constantly monitored the situation. So constant monitoring, and I can say it's not only for Austria, but I can say for many countries, there has not been constant monitoring with regard to the data that was used and with regard to the modeling that was used. And there's also some reference with regard to the aims of the measures, the fair balance that has to be struck between the competing interests of the individual and of the community as a whole. And in both contexts, the state enjoys a certain margin of appreciation in determining the steps to be taken to ensure compliance with the convention. And again, with regard to Austria, I would say there has not been a fair balance, or there hasn't even been a discussion or there hasn't been a lot of discussion on fair balance of competing interests involved here. So what are the human rights requirements we can take from these court cases? First of all, there's a wide margin of appreciation, especially in difficult social and technical areas, which is the case in the COVID-19 pandemic. Then risk may suffice to create positive obligations for the state. I think there's no doubt that there are positive obligations for the state in this case here. Appropriate measures depend on the risk level. And I think, again, when I think about Austria, but maybe also about Germany, there hasn't been enough focus on what the risk level is with regard to different vulnerable groups and with regard to areas. Then from the court cases, one can take that measures must effectively protect, which is quite difficult if we have not enough knowledge as we had in the beginning of the pandemic and still might have. And then the decision-making process must involve studying, investigating, and monitoring. And with regard to Austria, I can say I wouldn't say that is the case. So that brings me to my final thing, to the possible measures we could take. And here I will draw from examples from EU secondary law. There are many areas where there are already some where there's already a regulatory framework in place for statistical modeling, for simulations or risk assessment, securities law regulation, animal disease law regulation, and energy law regulation, just to mention but a few. So what can we find in these secondary EU laws? For instance, terms and specifications shall be maintained in a database that is subject to formal and periodic audit. There shall be processes for formal reconciliation between the model and source data systems. An institution shall subject the model to a validation process. That validation process shall specify the kind of testing needed to ensure model integrity and identify conditions under which the assumptions underlying the model are inappropriate, include a review of the comprehensiveness of the model. I think none of that has been done, at least in Austria, and I think in many other cases, many other countries. The competent authority shall ensure that simulation exercises are carried out regularly. That is from animal disease regulation. Member states shall make available to the Commission and to the other member states on request a report on the main results of the simulation exercises carried out. Or when appropriate and necessary, the Commission shall lay down rules concerning the practical implementation of simulation exercises in the member states relating to the frequency. And finally, from the energy or gas market, ANSO shall carry out a union-wide simulation of gas supply and infrastructure disruption scenarios. The gas supply and infrastructure disruption scenarios and the methodology for the simulation shall be defined. And ANSO shall ensure an appropriate level of transparency and access to the modeling assumptions used in its scenarios. So finally, what can we take from these regulations for possible measures for COVID-19 modeling? I think there should be minimum requirements for the data set. There should be a regulation on that. There should be transparency of the model assumptions. There should be minimum requirements for practical implementation. There should be testing obligations, frequent testing of the model, and finally, reporting obligations. With that, I leave it with that and leave it for the discussion. Thank you very much.
Okay, thank you very much, Iris. Maybe you can remove the presentation. It will be easier.
Yeah, I'm trying, but I'm not quite sure.
There's a question from Professor Klaus Heine. He asked the following. International human rights might not be the only way to approach big data and statistic modeling. For official statistics, there are ethical guidelines from the UN, which have exactly the same problems you are mentioning when private parties are involved. Why not broadening those UN conventions for official statistics to private bodies when your set of problems occur? At least the implementation problem should not be bigger than with approaching the problems from human rights.
Thank you very much for this interesting question. I think it's just a different approach. Usually we speak much more about ethics and ethical questions when we come to big data or modeling and or statistical modeling, and we speak less about human rights or legal provisions that are already in place where we can draw some principles from. So I think it's just two different approaches and probably both lead to similar results.
Let me ask if any of the other panelists have questions for Iris as I wait for the Q&A from the broader public. Niva, Maayan, Yuval, or Limor?
There is another question in the Q&A. In the answered category?
Yeah, I asked the other questions I asked her to rephrase her question. So, yeah.
Is there another question?
Yeah, well, there's a question from Olesia Kortekova she's I think a PhD candidate from Russia. She asked about the type of human rights, the type of elements that a human rights mechanism should include in order to have some force as a regulatory mechanism. If I understand her correctly, I'm not sure. It would have been easier to ask her to clarify, but she didn't. So I'm not sure.
So I'm trying to read it also. I'm not quite sure. I'm not quite sure if I really understand the question, and if the question is with regard to if the measures, whether we need some different human rights doctrine, I'm really not quite sure. So maybe, Olesia, it would be great if you could rephrase your question. So in order for me to be able to answer your question.
So one thing that I have in mind is something that was we explored in a different project, is whether we can algorithmically codify any human right requirements into the codes that we use in our data manipulation. This way we can be sure they are actually implemented because they would be an integral part of the code.
Yeah, like security by design, what we have in data protection, or safety by design when it comes to biotechnology.
Yeah,
I think that would be, I think that would actually be important to try to codify that in order not to have discrimination. But I think we are still, I'm not quite sure if that's already that easy to implement that into the algorithms. I think it would be already great if those who simulate and model are aware of some human rights requirements.
Yeah, we have. Yeah, I must confess that I myself I'm skeptical about the ability to codify this type of very broad principles, but this is definitely an issue to think about. So we have a question from Evert Stamus at Rotterdam, and he asked, he said that you quoted from Atom case. Did you deliberately use the word constant monitoring where the quote was using the term consistency?
So what I said towards the end, that I think that there should be constant monitoring, I was using that deliberately. I take from all the cases that there should be constant monitoring when we use this kind of statistical modeling that lead to the human rights in violations, or not violations, interferences we are experienced, or we have been experiencing within the past year.
Mm-hmm. Okay, and just a moment. So I think we have, there's one more question from Klaus.
This is a very good question where we would have algorithmic regulation. Of course, international regulation would always be the best, but I don't see that happening. In certain areas, I would see algorithmic regulation on the European Union level, and I think the most likely would be on the national level. Not because I think it's the best level to implement it, but just the easiest way to implement it, or the most likely way to implement it.
Okay, and we have, I think, the last question from Ayelet Sela. Ayelet, please.
I thank you for your presentation. My question has to do with the auditing. I'm curious as to what you think should be the characteristics of such audit and who should be performing the audit, especially when we talk about representatives of the public or someone who could provide scrutiny and criticism from the outside.
Yeah, so I think auditing should be, well, if I talk about the Austrian case, I think auditing should lie with the state, state agency, but I see the problem to get really, to have a state agency that is capable in doing that. But I don't see how the market could regulate that. So it would have to be a state agency.
Okay, thank you very much, Iris, for this fascinating presentation, and we can move to the next presentation: speech governance by AI, tracking disinformation, with Professor Niva Elkin-Koren, who is a professor of law at Tel Aviv University Faculty of Law, former dean of Haifa Faculty of Law, and founding director of the Center for Cyber Law and Policy, and of the Haifa Center of Law and Technology, and Dr. Maayan Perel, assistant professor at Netanya Academic College School of Law, and research fellow at the Center for Cyber Law and Policing at the University of Haifa. So please, Niva and Maayan, the floor is yours.
Thank you, Oren, very much for the introduction. Thank you to the host for this great event. Let me just share my screen. Hopefully everything will work. It's okay, you can see, right? I can start?
Yeah, just put it on a presentation
mode. Sorry, yeah. Sorry.
And you have 20 minutes, and then please note, I also remind the audience, there's a Q&A which you can use.
Perfect, thank you, Oren. And again, thank you to the host and for all the huge audience, I must say, for coming here and giving us the opportunity to present and discuss this paper. So this is a joint project of Niva and myself about sustaining pluralism in speech governance by AI. So in this project, what we're trying to do is to highlight one very important feature of democratic public discourse that we think we might lose when we shift from moderating speech by law to moderating speech by AI. And what we mean by pluralism is, in the very basic sense, is giving room to different legitimate conception of values and allowing them to coexist. So the main argument of this project is that shifting from governance by law to governance by AI may risk this important feature of liberal democracies. So in a nutshell, what this paper is trying to do. So first it identifies the pluralizing features of the law, which are essential for, of course, for modern democracies. And then it shows that these features are lacking in speech governance by AI. The last part will provide some policy interventions, possible policy interventions that are meant to insert by design some of the pluralizing features of the law into the AI systems of speech governance. So our starting point is that deciding the boundaries of speech is a challenging task. It depends on many factors. For instance, who are the audience, and what is the strength of the values that are put at risk. So misinformation, of course, is a boiling example, and it's a very tough question to decide what should count as misrepresentation and what should be tolerated under freedom of expression. And when we're talking about misinformation in the area of COVID-19, even in this small group of participants with we can say thinking alike scholars, there is disagreement about what is misinformation and what is not. In the past few weeks, we have all witnessed the spread of questionable information regarding the COVID vaccine, claiming among other things that it could alter people's DNA, or that it could microchip and track individuals. At the same time, there are those who argue that the vaccine is here to help us win the pandemic. So there is no consensus about the substance of these representation and whether they should be considered fake news. Arguably, it should make a difference if the speaker is a medical doctor or an influencer on Facebook, for example. But in the bottom line, we don't agree. We don't agree about what is and what is not misinformation. And another layer of disagreement is who should decide what is legitimate and what is not. So currently, platforms are those who decide, and they decide by using AI tools to detect misinformation. But the way that these tools make such a decision is inherently different from the way a democratic legal system would decide. So how does a democratic legal system decide about misinformation? So we don't have, at least here in Israel, a law about fake news, but what we do have is Israel Consumer Protection Law, for instance, that we can look at it to see how it would decide a question about misleading dealers that misled consumers. So you see highlighted in yellow, the law defines misrepresentation as an act or an omission in writing by word of mouth or in other manner likely to mislead a consumer as to any matter material to a transaction. Afterwards, in the bottom, it provides a list of presumptions regarding matters that should be considered material to the transaction, such as the quality, the weight, the quantity, the measurements of the commodity, and so forth. So the law basically provides the general rule about misleading, and the general rule would be applied by a distributed network of judges to different specific cases and lead to specific different outcomes. The law is not monolithic. It doesn't look for one correct answer, but rather it has pluralizing features, pluralizing mechanisms that enable us to negotiate differences. And what are these mechanisms that we identified in the legal system that we think that do not exist in governance by AI? So first of all, the law uses norms to decide the outcome. And these norms allow, give room for flexibility and dynamism because they allow us to agree on high-level principles, and then while deferring the disagreements to be resolved down the road, later in time, when a concrete dispute comes to the court. Sorry. Another important pluralizing feature is separation of powers. The legislator defines the rules and the standards in accordance with the social contract, which in itself may evolve and change over time. Moreover, lawmaking power is distributed among the branches of the government. So even the government can make laws and give room for different conceptions of values among different lawmakers. Another important feature, a pluralizing feature of governance by law is judicial interpretation. Again, we have different courts and different judges interpret the law, and this provides space for different conceptions of value and different balances between misinformation and free speech, or misinformation and public health. There are different balancing of the values, and these could be determined differently by different courts and different judges. And finally, another very important pluralizing mechanism which is lacking in governance by AI is the adversarial process that allows contesting parties to advance different and even contradicting interpretation of the law. And these different opinions are giving voice under the legal system. So even if they're dismissed by one court, they could later prevail in a different court. So in this way, the adversarial process allow us, again, to give a voice to different conceptions of value in different balances between clashing and contradicting rights and interests. And all of these pluralizing mechanisms are absent when we look at governance of speech by AI, as Niva will explain us in the second part of the presentation.
Okay, so the question is, what is lost in translation as we shift from governance by law to governance by AI? And there is quite a lot of research, some of which Maayan and I have conducted in the past regarding the risks that are involved in shifting into content moderation by AI, and that is the risk of error that is due to the fact that the system still cannot properly identify sentiment and context. The risk of bias that is arising from the use of biased data, the garbage in, garbage out problem, the privatization of decision-making to a handful of giant digital platform, and a lot of writing also on the lack of due process and transparency and explainability and accountability. But again, our focus is here is different. What we're interested in is the way in which, as we move from content moderation by law to content moderation by AI, we are losing some space for social deliberation on the substance, on the way in which we actually shape and develop our shared set of norms about what counts as legitimate speech. So just consider, for instance, the way in which copyright norms are created by content moderation by AI, and copyright is actually a good example, since it has been at the forefront of a lot of content moderation since the late 90s, and was early on has developed systems of automated removal for copyright infringement. So we can think of a platform like YouTube. YouTube would ask right holders to invite right holders to define their content, the copyrighted content, by a digital ID that actually identify which content is theirs. YouTube will upload this into its upload filter, and then would look for a match. If there is no match, then the content can stay. But if there is match, platform will either remove it or block it or monetize it, depending on the choice of the copyright owner. What is really interesting in this decision-making process is that first of all, not only exact match will be removed, but also similar content to the one that has been provided by right holders, but also that this system involves a feedback loop. So Maayan, if you can just do another click, I cannot, I cannot do it myself. This feedback loop means that every time I identified content or similar content, the system will learn how to better identify this particular context. And next time, for instance, if another material will arrive to the filter, if I removed in the first place 10 seconds of similarity, now I may remove something that is similar, that is 9 minutes of similarity. Whereas under copyright law, we would normally decide what is substantial similarity. Courts would have to make the substantive decisions about this, actually balancing between the right holder's interests and free speech or fair use. Here, what we see is that the trade-off is actually embedded in the system. So let's move back for a moment to look at the big picture. If we focus on disinformation, speech norms that are generated by AI are generated in a completely different way, so that norms in governance by law would be explicit, these norms in AI would be opaque. The trade-offs that are explicit when we decide by law and are transparent are concealed in the optimizing model. The way we decide in law is through deliberation and justification and reasoning. Decision-making process by AI would be probabilistic. The adjustment and change of the rules in law would be negotiated either by the different institutions that were described by Maayan or publicly, right? If we speak about the way in which we shape our norms through the legislator. Whereas in content moderation by AI, this change and adjustment of law of norms will be shaped by the data that would be exposed, to which the system will be exposed to, and of course the initial model. And most importantly, the institution is not democratic. The context is profit-driven companies. So when we think about what is lost in translation is the space for contesting views, for deliberating on difference, and for formulating a shared understanding of the social good. And so the question is, of course, here we can go next. How do we move forward? And our proposal here is somewhat linked to the previous discussion about whether we can codify human rights. This is not a proposal for codifying human rights, but it is a proposal to address a challenge in public law through legal intervention and intervention in the design. And the proposal here is to introduce disruptive friction. And by disruptive friction, what we mean is to introduce friction, right? So speed bumps are a great example of friction that we introduce in residential neighborhoods in order to slow down traffic and make sure that drivers do not hit pedestrians and keep them safe. And friction in content moderation would aim to disrupt the monolithic logic of and the optimizing system of the content moderation systems through the feedback loop that I've just described before. And so here are two very quick examples, and we can discuss them more during the Q&As. So if, as Maayan described, in law, we have a regulator, right, or a legislator that would define what is misrepresentation or disinformation, defining the speech norm. The judiciary will decide whether in a particular case the rule applies, and the executive would actually take care of the removal. In content moderation on digital platforms, what we have is one system that does everything. And here, proposals that we made in a different paper was to actually, instead of this separation of powers that we have in law, to introduce separation of functions, namely to separate the management or the governance of data that is done by the platform from the function of deciding and removing illicit content and enabling, for instance, by creating a duty to enable third parties or the state to run a system that would identify what is considered illicit content. Here you can actually have some competing models, right? It doesn't have to be one. And you don't have to remove it. You can actually simply mark it. And so that people that are looking at the content, in the case of disinformation, could be alerted that that might come from a questionable source. That would be one proposal for introducing disruptive friction that would actually also take care of the problem of potential conflict of interest in which a platform may enter, since on the one hand, they benefit from disinformation because it makes people more engaged. They want to stay more online, and therefore the platform benefit from more advertisement. And at the same time, being responsible for the removal of that content, either legally or in order to keep face to public criticism. The second example is also taken from another paper, and that is to introduce adversarial process into content moderation. And here the idea again is either to require is actually to require the platform to run the potentially illicit, right? Those postings that are identified as disinformation, to run it through another system, competing system, but independent system. That could be, again, either provided by NGOs or by the state that would represent competing values, other values, right? And so in the case of misinformation, we can actually have some representation of those who actually are, you know, if you identify anti-vaccine, we will have some voice for the anti-vaccine campaign. And here the purpose is not to decide, but actually to make the controversy more explicit. So it could be decided by some social institutions and then being fed into the system again. All in all, the idea of disruptive friction by design intends to make these disputes regarding speech norms more visible on the one hand, but also subject to some social choice rather than choice by a machine. Thank you.
And Niva and Maayan, can you remove the presentation?
Sure.
Great. So we have 10 minutes more or less to questions, and we have a question from Klaus Heine from Rotterdam. Democratic pluralism implies a failure, but a legitimate one. Is the problem here that this cannot be reached analogously on the platforms you are mentioning? I hope I know.
Yeah,
it's clear.
So I think that the problem is that right now, the way content moderation systems are designed, they are designed in a monolithic manner. And so we actually agree that there could be some plurality. There is nothing that is inherently problematic in deciding by machine learning systems. And that, by the way, not necessarily has to do with public discourse. It could do with other mechanisms of deciding things like governing the traffic. You have to make some trade-offs. If you can either optimize how quickly people will drive or optimize the benefits or the harms for the neighboring cities near the highway to make sure that no one, right, or the interest that no one will drive through their little roads. But you have to make a decision, and the system will optimize the value, and that trade-off will be embedded in that system. And what we are trying to suggest is that an important democratic value is deliberation about these decisions. And that in order to enable such a liberation and social choice, we have to make these choices more explicit. And that since this is not a one-time choice, this is something that has to be explicit through design, through the way in which the information flow is being processed and designed through the system.
Maayan, would you like to add something?
Yeah, yeah. I think I want to add about the ability to make mistakes. So or a failing balancing or trade-off between rights. So long, even when it's being done through the legal system, through the governance by law, it is important to remember all the time that this is transparent. We can actually see it and we can actually react to it. But so long the trade-off is concealed, we can never really know if there is a failure or if how to contest it, or how to fix it, or how to adjust from it, so on. Even the adjustment, as Niva showed in the presentation of the feedback loop, is inserted back into the machine, and we can never see it. We can never see how it develops over time.
Maybe one of the panelists have a questions for Niva or Maayan.
So I have a question about, well, I don't know if it's a trade-off, but traditionally we think about the way that we introduce this additional visibility and potentially ability to contest the decisions of algorithm through transparency and the ability to ex post facto provide some sort of auditing, which would later, I imagine, could potentially feed back into the decision-making process of the algorithm. And so I'm wondering what your thoughts are thinking, you know, in practical terms about the feasibility of introducing the pluralism into the decision-making process itself, rather than what traditionally has been thought as something that would be done ex post facto and wouldn't necessarily affect the original decision. And I think this is a really interesting proposal, especially since it may introduce a competing model to the idea that we should have some human decision-making as an appellate secondary decision-making body that could scrutinize the original decisions. And so would you think, and this is the second question, that introducing this pluralism into the algorithmic decision-making process could make that additional human review unnecessary, or at least not as necessary as some think today?
Thank you, Ayelet. And Niva, I'll say two words about it all caught me, but the last point. So I think that nothing can be better than a human checking everything, right? If that was possible, so I don't think we would be here, all of us in this online conference. But the idea is, as Niva explained, at least the first, actually both the example is to outsource some of the decision making, so we won't have only the platform deciding about everything and mixing and mingling all the decision with public expectation and business interest and having it all mixed up together. We want this friction is another thing that will affect the bottom decision, and even though it's still non-transparent, right? Because it's another system. It's not another human being that is writing the decision. It is still non-transparent, but it is another decision. We're adding another voice, another set of norms, another set of values, and we have something to compare it with. So this is the idea, I think, that of the proposal.
I'd like to add to this. First of all, you know, transparency has its limits. It's important, but it's really insufficient. And that is another, that is probably for another conversation, but I think that we have sufficient literature by now to show the limits of transparency. And second, with respect to human review, Facebook Oversight Board can decide one case, the termination of the account of President Trump, but it cannot decide each and every case of marking or removing or blocking every antivirus or anti-vaccine or anti-COVID or denial of COVID-19 posting. And I think that as lawyers, our proposal here is actually a call for lawyers to be more innovative in the way we think about intervention, to say that we should oversight AI only by human in the loop is naive, because these systems are pretty robust. And what we need is, of course, this is important and could be actually effective in some situations, but as a whole, we need to think structurally. And I think that as lawyers, we're trained to think of institutions. We have to actually implement this type of thinking into the new design of governing systems that are actually substituting now a lot of decision-making processes that have been taken by humans in the past.
Okay, I think that we have to move to the next presentation. So thank you very much, Maayan and Niva. It was a very important topic and will remain very relevant for the future. Our next paper is from Yuval Feldman, professor at Bar-Ilan University, who specializes in behavioral ethics and regulation. How to optimize voluntary cooperation in COVID-19 contact tracing app. A very relevant paper to the dilemmas we are currently experiencing. So Yuval, the floor is yours.
Thank you. Am I sharing the right screen or?
No, we see it as,
Just a second.
you have to change it.
That's better?
Yeah, yeah. Right.
Okay, so thank you to the organizers for inviting me. It's not my typical audience. I'm only starting to get into this whole area of algorithmic regulation. But I got into this specific topic actually by, as you know, many academics were involved in various advisory roles to the government in trying to deal with the pandemic. And I was in few thinking teams that were thinking about how to incentivize people or how to help the government mobilize the behavioral change with regard to wearing masks and being truthful in epidemiological investigation and with the vaccine. And in few of those teams, few of the leading ideas were to use apps. And those apps were supposed to some extent, maybe replace a kind of the notorious Shabak surveillance and try to get people to incentivize to get tested by using various apps, which were supposed to give them to have this information kind of help them get various economic advantages. And a major component in those apps, there are a few things related to incentives, but I want to focus in this presentation on the notion of voluntary cooperation, because the whole idea there was we don't want to use state surveillance, we want to replace it with various apps. And for that to work, we had to try and think how likely it is that the public will cooperate with kind of this new arrangement. So the behavior could be either to download the app as one voluntary, to report accurately on the app, to actually follow, be truthful when being asked. So this kind of behavioral component of behavioral cooperation I found to be very interesting and relatively understudied. And this is what I want to focus my presentation on. So this is kind of, in a sense, the diagram, right? So we have the Shabak, which is obviously a coerced. No one could choose whether you want to be surveilled or not. And then we have this dilemma between the voluntary approach, where we try to convince people, we try to nudge people, we try to incentivize them, relative to a more kind of mandatory approach, where the idea would be, it's not up to you, we create a duty, but it's not coerced as like in the kind of Shabak surveillance. And there are many dilemmas here. Again, I'm focusing only on one of them, which is the notion of motivation. From a behavioral perspective, one can think about four kind of challenges to the classical, okay, we're only going to focus on self-interest. One, and the famous one, is focusing on cognition. So this is the whole kind of Tversky and Kahneman famous approach. And And the idea from the COVID perspective is the problem where people assume, for example, that they are less likely than others to be sick or to get exposed, or although they are actually there, they didn't really breathe anything, so they should not report it. So all kind of biases that cause people to underestimate risk, underestimate probabilities. So this is one kind of challenge. The second one, and people speak a lot about, is the notion of legitimacy and trust. So to what extent do I actually trust the app or the people behind it, in a sense that I believe that they will be applied equally, that they do it in a fair way, that they're not going to use the information in other ways. So this is kind of a challenge related to legitimacy and trust, and it's a common approach to suggest that for people to cooperate, they need to trust who they cooperate with, and legitimacy is kind of one of the ways for governments to achieve that trust. The third one is the whole notion of self-interest. So to what extent people's motivation is dependent mostly about what is good for them relative to what to do with others. And this was, again, a major dilemma for the government all along, how to present the whole kind of COVID regulation. So are you doing it because this is healthy for you? So this is a really, really bad disease. Doesn't matter what your age. You're going to suffer tremendously if you're going to catch it. So be careful, use the app, protect yourself, get all the information about risky locations and all those ideas that were suggested within the COVID apps, because this is the best thing for you relative to more kind of, let's call it a solidarity approach, where people are supposed to, again, comply with regulation and be, in a sense, honest with the app, because this is solidarity. This is your moral responsibility to protect others. This is kind of more pro-social motivation. And in many surveys done by us and many others, it was a very common answer that people said, I care more not to infect, let's say, my grandparents. If you're very young, or if you're, I don't know, my age, or so, to protect your parents, you want to protect your parents, and I'm not so, and people say it's not about me, especially people in their 20s who supposedly for them COVID is not as problematic. I will actually challenge this answer, but this was a common one. And again, the idea here, how you design the app, which will try and understand whether it's more about people's self-interest or more about their kind of sense of solidarity. And the last one, and this is kind of related to my own research work on behavioral ethics, is related to an actual problem that I think everyone recognizes now, that it's not that, I think there is a common, or it used to be some sort of a common assumption that the majority of the people will cooperate if you ask them nicely enough, but there is only few people, kind of the bad apples, that you need to deal with in other, maybe, more coercive ways. And I think all over the world, we came to recognize something which was known for people who were studying behavioral ethics, that it's actually not the case, that there are various behavioral mechanisms that cause many, many people not to cooperate because they, again, perceive the situation, think that they do as everyone else, think they're justified not to report because they have a very important meeting tomorrow. No way they're going to get into quarantine, so they're not going to report it to the app that they met someone. So people have a lot of kind of behavioral mechanisms, which, even though they are ethical people in their own perception, in a given situation, they will find many ways to either ignore or kind of justify not behaving according to what they know is the right thing to do. And this is kind of the maybe behavioral challenges to achieve cooperation from the public with regard to actually trusting those apps to help us kind of manage the risk with regard to COVID relative, let's say, to the Shabak surveillance. So this is just kind of a meta-analysis to show how bad is the situation. And overall, in dishonesty studies, there were something around 50% of the people cheat. In some studies, you can get to 80%. So just to convince you, this is not bad apples we're trying to deal with. Those are actually many people in a given situation might behave unethically, and we have to understand how to deal with those people. So what are, again, some of the challenges with regard to COVID? Again, as I said, should we impose duties? And this came again now with regarding to the vaccine, or we can trust people responsibility. To what extent it's possible for states to trust their own citizens? So we talk a lot about the reverse, right? So how much people trust the court and the parliament, but I'm actually trying to look at it the other way. And especially again, sadly enough, when you look at various international rankings, you see Israel not very high in many of the relevant domains. So again, the question is, could we say that some states are more likely to trust their citizens than other? In some countries, the public will be responsible enough to always cooperate, in some less. Is that something that you can even change, right? If you see it, look at research about culture, to some extent they talk about thousands of years explaining why there is this variation in culture. So again, it's an open question. Again, some of the challenges with the COVID is that I think it started, we talked about 2-3 months. Now, I think after a year, people still say it's maybe another year or even more. So again, even people's cooperation to some extent could decline simply because of what has been called the fatigue. What's the kind of role? So are you more likely to get cooperation? And various civil society organizations try to come up with their own apps to convince people, and you can trust us, you can report to us who you met, and we're not going to tell the government, but we trust your civility or your kind of morality to be truthful with us as a way to kind of stop the pandemic from spreading. Another kind of dilemma, and this depends in many behaviors, is what is the proportion of people that you need? Okay, so we know a lot about heterogeneity in a population, about how preferences for ethics and cooperation differ. And the open question is, it's not always the case that we need 100% cooperation. In the vaccination, in the beginning, I remember they were talking about 60 to 70%. Now, because of the British variant, they want, and the fact that kids cannot get the vaccine, they talk about they need, I don't know, 90, 95%. So even the proportion that of cooperation you need will affect how likely you are to be able to trust the voluntary component, because there aren't as many people who would do it. Again, another open question. So one of the advantages of voluntary cooperation, it's likely to be of a higher quality. So if you talk about try to make sure, again, people are truthful with their report. So whether the report to, the military calls them and tell who did you meet yesterday, and you try to think of various approach how to make sure that they're going to be accurate. Definitely, if someone is doing it without kind of the willingness to cooperate, he's coerced to do it. They say, if you don't cooperate with us, you might get in trouble. It's very hard to rely on that, because in many situations, there are only two people. No one could know if you lie. So in some contexts, you actually have to rely on people's goodwill. And then the question is how much you care about that, right? So even the dilemma whether to use voluntary cooperation or not depends on the quality. Some say, for example, about the vaccine, although it's more intrusive, but in a sense, it doesn't matter if you smile when you get the vaccine, right? So you get it. It's in a sense, I'm not talking about autonomy or rights. I'm just talking from the behavioral perspective. So again, it depends, what do I need from the public when I regulate it? Do I need them really to do it because they believe it, or it's enough for them to do it even if they do it unwillingly? And so again, this is always related to people's level of intrinsic motivation, which differ between the types of behavior. And again, we need to understand, and this was another dilemma in the design of the apps, is how much you want to focus, for example, on locations, right? And you create a lot of possible, not just the privacy obvious one, but also about kind of differentiated approach to different regions in the country if you allow location to be accounted for in kind of the risk number you assign to people meeting with that many other people. The behavioral approach, Oren, how am I with the time?
I think about 6 minutes.
Another 6 minutes?
Yes.
So I will actually, yeah, so obviously the behavioral approach, I'm obviously invested in it, but it creates a lot of dilemmas that we need to understand about what to combine with the apps with regard to incentives and nudges, and to remind people from time to time, remember to report certain things to the app so we can have the accurate knowledge. I will actually skip this and maybe just explain some of the challenges. So the notion of the ambiguity that we have in the context, and many people know it, whether, did I actually meet this guy? Were I 2 meters from the guy? Was that the open air? There's so many ambiguity in the situation, which again, harm the likelihood of voluntary cooperation, because people are likely to engage in various self-serving biases that prevent them from understanding the situation as they need. There is the problem that you not necessarily see the person that you harm because of the delay in the time it takes you to develop symptoms, and it's not necessarily the person you meet is the person who's going to get infected. Some of the problems with the applications that they require you to be active, and we know that people are less likely to be ethical when they can basically sit and do nothing. There are various problems with regard to people understanding. So, for example, I could have lied a few times and nothing happened. This kind of creates problematic learning. Sometimes you do it part of a group, then people are also less ethical. People believe that, and actually this came up in some surveys, that the public believe that no one is being honest when with the app or with the Maayan, which was and somewhat unsuccessful attempt to replace the epidemiological investigation with an app. And so this is some of the challenges. I actually want to skip to some of the empirical finding, but again, just to, I was talking a lot about the problem with voluntary cooperation, but also in some other studies I did with people from psychiatry, trying to focus on kind of how compliance affects people's mental well-being. So one of the findings is related to the fact that voluntary compliance in a sense is healthier. So you're less likely to suffer some of the problems that people reported to be associated with feeling that they don't understand what they need to do. They feel that there was too much kind of stricter, and you see it also in variation between countries. Those could be reduced with voluntary cooperation. So when people feel more empowered and then decide whether to cooperate or not. But again, our main problem is how to balance it with those people who decide not to cooperate. But it's obviously advantages both from a kind of therapeutic approach in terms of people's behavior indoors, which you cannot monitor, which reduces the fatigue. But again, I think this was in the news, that something like 2/3 of the people evaded quarantine at some point, right? So this is a lot, right? And this affected many of the more strict decisions the government had to make. But if we started with this slide with the 50% of the people cheating in dishonesty games, here you see 2/3 of the people in Israel who had to be in quarantine actually went out. There are some problem with those studies, but this is kind of the current perception. At some point, it was reported that only 11% of the people who had to register the fact that you get into quarantine in the health ministry website, so only 11%, which is obviously a very low cooperation. Let me go to just kind of show some of the problems with the nudges, which is some of the advantages of algorithmic regulation is that you can actually very easily incorporate all kind of reminders. So this is a famous one, a study that showed how people, when they sign first and don't feel, they're more likely to be honest. And as some people know, this study had to be retracted, so it could not be replicated. We work actually on some different approach to ethical nudges, which involve pledges rather than just signatures, and we have better evidence with that, also related to some of the things with the usage of apps in the COVID context. But again, this is something to worry about. This is an example, I'm sorry for the Hebrew, but it basically, it's a study done by Shachar Eyal and his students. He's from the IDC, and he tried to nudge people not to cut into a gas station and kind of, in a sense, save some time for them, but actually decreasing the overall welfare, because when you get back into the jam, you create greater problem. And he showed kind of really nice results in the beginning. So just having the sign, people behave more ethically. But as you can see, as the days passed, people actually got some adaptation to this moral reminder, and this happened. These people actually came back to even worse than they were before. This is another study with Mariam Kochaki and Francesca Gino, where also something which was discussed in the context of the COVID was kind of the language used. So are you supposed to be kind of more, some of the discussion, for example, of the female leaders of country relative to male, and there were some advantages with countries managed by or run by women, was associated with kind of a more inclusive approach. And actually in our study, not just in the context of ethical behavior, we find the opposite, that if you're nice to people, they're actually more likely to cheat you. This is kind of some empirical studies we done on why people cooperate. And maybe for that, you can see, for example, some random factors affecting people cooperation. So whether you actually know someone is over 75, it's very much likely to affect your behavior, how easy it is. So again, we see that the classical approaches were not working in COVID context. This is another a study done with Yossi Arel-Fish and Walter Manor. And again, this is just kind of to show the coefficients, and we divided by gender and age. And I think also interesting to see kind of the huge variation between the age groups. So again, you think on one rhetoric, and this is, again, something which is easier to do with apps, where you can more differentiate messages based on characteristics of who have them. But this suggested the things which were working on some age group actually didn't work on some of their other age groups. And the last one, we actually studied the social cooperation with apps. We showed one kind of, I think, somewhat sad finding, and I will end here. I think I'm already passing the time, that in a sense, the people were very much in support for voluntary cooperation and apps that people can choose whether to download or not, the less frightened they were of COVID. So the more worried you are of COVID, you actually didn't trust people so much, and you want the government to force people to report whom they've been in touch with. And again, this is somewhat problematic situation to be with. So in a lack of time, I think I will stop here.
Okay, thanks, Yuval. We have a question from Klaus Heine, and he asked, how would you assess the possibility to work with regulatory threat if the app is not voluntarily appreciated by cooperation? Then the compulsory introduction will follow. So if I understand him correctly, it's a kind of responsive regulation approach where you climbs up where you escalate the regulatory approach.
Right, but so the idea would be, but the problem, I guess, is that it's not in contrast to many other regulatory contexts, here there is the government and there is the public. It's not so much that, let's say some of the first of all, the problem is you're not necessarily certain if people cooperate or they cheat, right? This was the problem, right? People can say, I'm fully cooperating with you, and the reason I didn't kind of say something on the app that I met someone or that I got an SMS saying that that I need to get into quarantine, or all kind of things that people are required to report to the app. It's not that I'm not cooperating, I'm basically cheating. So again, the governments could know sometimes on an aggregated level that people cheat. They not necessarily can tell who is cooperating and who is not. And again, there was, I think there was an open question. I'm not sure even how it was decided that they didn't want, for example, the people in charge of the epidemiological investigation to be able to punish you if you cheat, right? They tried to have kind of some sort of separation there. So I think, first of all, it's not necessarily that you know if someone really cooperates or you basically cheated. And second, let's say he did not, you cannot threat him individually, right? It's usually should be either you rely on Shabak surveillance or you force everyone. In a sense now, some of the things they speak now about the green passport dilemma, so whether only vaccinated people could enter various shows, this was suggested earlier with regard to people with the app. So if you want to get into the mall, you will need to have the app, which was some sort of mandatory approach. And at the end, it didn't work, but it was very hard to say to people, okay, if you don't cooperate willingly, we're going to move to the other approach, because it has to be, in a sense, a decision about everyone, not about one individual who did not cooperate.
I must say that my feeling is that there are certain threats that for democratic countries are simply not credible. So there are some things that you can do in China, but you can never do in democratic countries, and and we see it all around the world. In democratic countries, there are failings as they go to the threats scenario, and
right,
this is a difficulty.
But it's interesting again that with regard to the apps, so maybe the feeling was that I'm just trying to compare now the public sentiment with regard to preventing people who choose not to get the vaccine relative to the public sentiment with regard to people who didn't download the app. And it seems that, so it could be that people trust the vaccine more. So they say, okay, we are willing to allow this differentiation in treatment based on the vaccine, but not based on the app. So I think a few months ago, if someone would tell us that so many people in the public would support that, I would be very surprised. But somehow, I don't know if there was some survey of the public, but it seems that the public sentiment is actually fine with that, right? So yes. Sometimes when you say democratic countries will never support something, this actually sometimes change, right? So people, I don't know, are...
Yeah, and it's interesting that this is something that is, I think, unique to Israel. The relative support of the vaccine is not something that you, for example, that exists in France, for example, where I think there's much more skepticism of both government and the medical community, which is, so it's a bit strange, even though we are now worried about the vaccinating the rest of the population. Still, it's quite impressive, the support that the vaccination has. Maybe if there's any questions from other people at the panel, because we don't have questions at the Q&A.
Yeah, so I wanted to ask two questions. One is related to the justification, so that I think that is following up on some of the issues that Oren raised. To what extent it makes a difference what the justification is, so that in the vaccine, for instance, does it matter whether the vaccine protects me or whether the vaccine protects others in terms of, if it turns out that people who are vaccinated are not infecting other people, that would become a public health issue, which probably strengthen the legitimacy of the government to require it, to say, listen, you're putting other people in danger, excuse me, you can go on a train, right? Or something like that. So the question is, to what extent, the legitimacy of the justification makes any difference? And one more broader question, COVID-19 is like the dream of every social scientist in terms of providing a global lab for comparing cultures. And are there any comparative studies that actually manage to identify things that are common across cultures and countries, regardless of whether the prime minister is being suspected of something, their government is democratic or not, or the culture or the subcultures, as we know? I mean, so these are the two questions.
So first of all, just it's not what you asked, but there are studies who showed that people who get the vaccine are less likely to infect others. So even the people who got sick, their viral load is sometimes even 20 times lower. So just to clarify that point, but I think you're definitely right. I mean, obviously, it's easier to encourage voluntary cooperation if you make it into more kind of a social. If it's only me, so people can say, okay, so why would you care, right? So this is like the seatbelt dilemma. So whether wearing a seatbelt is something between you and the state, or it's something to protect others, this is something that governments try to shift to encourage cooperation by people. With regard to your question about culture, so it just came out in the Lancet. There is a model by Gelfand. I think she's an anthropologist, maybe based in Maryland, I'm not sure, about loose culture. So she has a famous science paper from a few years ago, dividing something like 60 plus countries based on how kind of loose is the culture in a sense of willingness to tolerate deviation in social norms. And she actually finds a high correlation with success with COVID cooperation. So when the culture is more loose, they're less likely to, more loose, less strict. Their performance with regard to COVID was poorer. So in a sense, some would say this might be a post hoc analysis, but like the Asian countries being better in making sure everyone is with a mask and not tolerating anyone without it, not tolerating people out, people saying I'm in quarantine, but I don't care, I'm going around. So in some culture, people say, what do you do? Like, you cannot do that. But the more loose is the culture, it's less likely to work.
Another step in decline in democracies.
Yuval, one last question from Antonella Zara. Are you aware of any case where people were incentivized to download the app in exchange for a free COVID test or some fast lane to get vaccinated?
So this was offered we proposed, actually, it's funny, we proposed 3 apps. None of them actually, at the end, for various reasons, didn't work. But this idea was there. So once you have it, so the idea, you're more likely to know if you're infected, but we're going to give you access to fast tests. And even the idea was that we're going to give you more tests, so to shorten the quarantine days if you choose to download the app. But none of this materialized, but this was definitely part of the idea in the making to have that option. Yeah.
Okay, thank you very much, Yuval. And our last speaker for this session is Limor Shmerling Magazanik. She will talk about using health data for research supported by fair information practice principles, evolving national policies. And Limor is the managing director of Israel Tech Policy Institute. She provides leadership on day-to-day operational matters of the Institute, direct its policy agenda, and engage policymakers, regulators, academics, and business leaders. Thank you for being with us, Limor, and the floor is yours.
Thank you, Oren. And thanks, Ayelet, for sharing my slides. And thank you to the organizers for this opportunity to share my thoughts with you. My talk today will focus on the intersection of medical research and data research. It applies in a broad sense to health-related research and big data research. And it's an intersection that brings together legal frameworks from both biomedicine and data protection. It also relates to the development of AI, as that involves using health data and developing health services. I will specifically focus today on the secondary use of health data for research. That means data that has been collected for the primary purpose of healthcare giving and is then repurposed for data research. Imagine you are an AI company developing a virtual reality solution for a genetic disability. You wish to gain access to relevant patient data held by a sick fund, a health management organization, and a hospital with expertise in this condition. Each are in different countries. You wish to also partner with expert academic researchers from 2 different other countries. Or imagine you're a government coping with a pandemic caused by a virus, and you wish to base policy decisions on data and share it with others who can maybe contribute analysis or hopefully solutions. So the COVID-19 pandemic has really emphasized the crucial role that data collection, analysis, sharing, dissemination, access plays for both governments, academics, and private sector business. Everyone was racing to advance scientific research to help combat the virus and also to base government decisions, policy decisions on lockdowns, quarantines, economic issues on data in order for them to be more reasonable. I'll start by presenting some regulatory fundamentals in medical research and data protection. I'll continue with the components of these new emerging national frameworks that enable access to health data for research that we have surveyed in the past year. And I'll also describe the safeguards that accompany those frameworks, and we'll try to highlight the similarities and the tensions between the different frameworks in different countries. Next slide, please. So regulation of the use of data and regulation of medical research serve us in building public trust in scientific and state institutions. As discussed previously, public trust in our institutions is both critically important and somewhat under a decline. There's a considerable background of norms and policy tools to interventional human health research. That is the clinical research involving the human body. So these includes the World Medical Association's 1964 Declaration of Helsinki, which is a statement of ethical principles for the medical research involving human subjects. Interestingly, for me as a data protection professional, in 2000, it was amended to include research on identifiable human material and data. It is addressed primarily to physicians, but recommended to others as well. It acknowledges that medical progress is based on research that ultimately must include studies involving human subjects. So research is essential. And participation of subjects in this research, known as clinical trials, must usually be based on informed consent, a concept that we as legal professionals are quite familiar with. Furthermore, the Council of Europe has created the Convention on Human Rights in Biomedicine, which states that scientific research in the field of biology and medicine shall be carried out freely, subject to the provisions of the convention. Also stating that everyone has the right and to respect for private life in relation to information about his or her health. So we have an equation for many years, going back many years. Medical research is essential and even constitutes an imperative that is part of serving our human rights to life and health. It involves the human body and should not be conducted without each person's informed consent. Medical confidentiality has been a cornerstone of modern day medicine. And this research we're quite familiar with usually requires or almost always requires the approval of a Helsinki Ethics Committee. Next slide, please. Now, moving from the medical space to the data processing space, in 1980, the OECD guidelines laid out the principles of privacy protection to enable trans-border data flows in a secure and safeguarded manner. These apply to any type of personally identifiable data in any sector, be it health, finance, education, government services, e-commerce, etc. A primary principle is the collection limitation principle, which is that data processing requires a legal basis. There should be limits to the collection of personal data, and any such data should be obtained by lawful and fair means, and where appropriate, with the knowledge or consent of the data subject. The EU General Data Protection Regulation, the GDPR, sets this principle specifically. Next slide, please. The GDPR also recognizes that scientific research is an issue of prime interest to the public. Recital 159 reads, for the purposes of this regulation, the processing of personal data for scientific research purposes should be interpreted in a broad manner, including, for example, technological development and demonstration, fundamental research, applied research, and privately funded research. So for example, a private sector company like our AI startup can be involved in such research, and that is permitted. It could be a pharma company or tech companies. And the purpose could be an AI model development that has a legitimate purpose. Next slide, please. And explicit allowances are made for the secondary use of personal data for scientific research in the GDPR. So Article 5 says personal data shall be collected for specified, explicit, and legitimate purposes, and not further processed in a manner that is incompatible with those purposes. This is the collection limitation principle established, but then it goes on to say further processing for scientific research purposes shall, in accordance with Article 89, that requires safeguards, not be considered to be incompatible with the initial purposes. So we have the groundwork to allow the use of data for research. This opens the possibility of repurposing care data for big data research, and also clinical research data for additional big data research. I wish to emphasize a significant difference I see in that big data research is non-interventional in nature. It does not involve the human body directly. It is also generally including much larger quantities of data and much larger sizes of the population. So the risks involved are stemming from the data protection thought and less from the clinical trial thought. This may sway the balance from the emphasis on Helsinki type and patient laws, legal basis and approval duties to data protection type ones. Next slide, please. And since we are discussing health data, another set of rules in the GDPR applies. Health data is a special category of sensitive data, so processing it is forbidden, but for several permissions, including reasons of substantial public interest, reasons of public interest in the area of public health, such as protecting against serious cross-border threats to health, like a pandemic, and scientific research. This article requires that these derogations apply only if a country, a member state, legislates specific law that allows for that data processing to be conducted without people's consent. Next slide, please. Now, if this wasn't complicated enough, moving closer into the national level, we found legal frameworks governing the secondary use of healthcare data for research purposes even more complex. They typically include at least 3 layers of laws and regulations: general privacy and data protection laws on the national level, which regard healthcare data as sensitive information as well, and subject to strict protections, patient privacy laws, and public health regulation. In certain countries, such as the US and Australia, a federal system adds complexity with state and provincial laws providing additional layers of regulation. In England, for example, secondary use of healthcare data is governed by a complex legal framework, including common law, statutory law, and government decisions and recommendations from Health, Ethics, and Data Protection Authority. And in this context, GDPR provides latitude for national derogations that have led to extensive member state legislation. This sure is a complicated legal landscape. So next slide, please. In 2017, the OECD recommended that member governments legislate data governance frameworks to facilitate the secondary use of health data for research directly. These had two goals. One was to advance the collection, standardization, aggregation, and streamlining of access to big health data. This is due to problems of data quality, data linkage, data standardization. And the second goal was to streamline the legal and bureaucratic process of gaining access to data and collaborating in research, so that it will be allowed for multi-stakeholders and nations to collaborate on health data research. In the past 2 years, countries around the world are charting new paths to seek the insights that health data can reveal while respecting individual rights. Next slide, please. So this is our survey that we did at the Israel Tech Policy Institute together with the Future of Privacy Forum, which we're an affiliate of. And we looked at 8 countries, including Australia, England, Finland, France, India, Ireland, Israel, and the US. And very generally speaking, on the macro level, we found commonalities across legal systems and regimes. So in permitting secondary use of healthcare data for research purposes, they all do that. In the types of conditions, including review by ethical boards, proper de-identification, and additional measures, there are commonalities. But on a closer look, there still remains significant nuances and ambiguities that challenge the potential of collaborating on health data research within organizations in nations and on the international level. Next slide, please. So health data that may be used for big data research is defined broadly. It includes administrative health data, insurance, demographics, diagnosis, symptoms, prescriptions, immunizations, tests, environmental and social elements, and additional medical conditions. Legal frameworks typically extend the definition of secondary research to both academic, government, and private sector entities, including pharmaceutical research, including pharmacovigilance, and even to product development and preventive medicine. In 2019, Finland, for example, enacted a law explicitly intended to clarify the legal basis for the broader secondary use of healthcare and social welfare data. The law aims to encourage use of healthcare data for socially valuable purposes by enabling data users to have a one-stop shop for access requests to such data. The law also created a new government agency specifically tasked with collecting and managing healthcare data from numerous disparate sources, securing the data, and efficiently processing access requests from researchers. One key benefit of such centralized systems is the simplification of the bureaucratic hurdles, where researchers, our Finnish colleagues told us that where researchers once had to wait 2 years or more to access information, they can now clear the process within 3 to 6 months. France has a similar model with a twist. They are also creating a central health data hub, collecting many databases into it from across the country, managed by a dedicated authority. The application for data access is to this authority, and its ethical board decides on the existence of a public interest in the research. But then there's a second stage. After that, the National Data Protection Authority, the CNIL, will be involved either as an approval authority or since it has published methodology, reference methodology for researchers who wish to abide by the process, it is possible to self-declare that you are compliant with this methodology, send in a notice to the CNIL, and you can proceed with your project. Researchers that do not certify need to get the CNIL's approval, and the CNIL will do a review process before approving access to the data. Other countries, such as England and Australia, rely on an existing national data repository of patient records, the EHR, the electronic health records. Their laws are focusing on granting access to those databases, not necessarily on the creation of a whole new infrastructure that holds tens and hundreds of other databases. Next slide, please. So now briefly on the complementary safeguards. So if we remember at the beginning, we set out with Helsinki committees, clinical research, consent required both for data research under GDPR and other laws and under medical research regulation. But here in these frameworks, in place of consent, it is possible to receive approvals or waivers of consent by ethics boards. And these processes are similar in various countries, but with some variations. So all legal frameworks explored in this project generally empower the patients themselves to authorize healthcare data research. They can do that with explicit consent, but this is, however, not the basis that will be chosen in most cases. Often it's infeasible, especially where data is used for purposes which are unexpected at the time of collection or for population level research. Furthermore, it's important to note that the European Data Protection Board has advised that the informed consent that ethics committees often require for research may not always align with the legal basis under data protection law, due to concerns that in a clinical trial relationship, data protection consent may not be freely given. So another legal basis other than consent is required under data protection law for access to the same research data. EDPB just recently, 2 weeks ago, reiterated that consent for clinical trials and consent for data processing are not the same and should not be confused. All countries surveyed by us, therefore, also permit data research on other grounds, and with additional safeguards such as ethical reviews, pseudonymization of the data, security measures, and contractual agreements. So in the US, an institutional review board or a privacy board can award a waiver of consent if the use or disclosure of healthcare data involves no more than minimal risk to the privacy of individuals, and that the research could not practicably be conducted with patient consent or without access to and use of the data. In Australia, research is permitted where obtaining consent is impracticable. The information is necessary for the research. The research outcome is relevant to public health or public safety. And a Human Research Ethics Committee has approved the project, and sufficient de-identification is deployed. Under Irish law, a data controller seeking an alternative to consent must also apply to a special central committee to assess whether the public interest in conducting health data research significantly outweighs the interest in obtaining patient consent. Similarly, in France, a board decides if the research purpose is in the public interest. In English law, we found similar. A research ethics committee is empowered to waive consent for health data research. In some countries, such as France, England, Finland, patients are provided with the right to opt out from having their health data analyzed for scientific research. This is something that has raised concerns and critiques. So for one thing, it is argued that in some cases, a general opt-out right could unintentionally skew the research results, injecting bias into public health decision-making or into machine learning algorithms. Since if specific types of populations or people exercise their rights to opt out, that may create variances in the data and make it not representative of the full population. There's another conceptual problem that has risen that opt-out is a part of the individual consent model. And therefore, if consent was waived, why is opt-out still awarded? That is something that has puzzled some of the policymakers. In some countries, to be approved without consent, research must also be deemed to be in the public interest, as said before. In others, such as the US, research must contribute to human knowledge, a much more generalizable notion. The manner in which these legal grounds and safeguards are structured or prioritized and the extent to which consent is privileged creates variations across countries. And these divergences in turn pose limitations for both research and scientific collaboration. Another technological type of safeguard is de-identification, which is under most data protection frameworks defined quite differently. So firstly, under most data protection frameworks, anonymized data is not subject to legal protections. But there have been quite a few demonstrations that anonymization is not a silver bullet, not a fail-proof method. And then this is reflected in the legal frameworks. So for data to be considered anonymized, some countries require that re-identification of the data be practically impossible. Others accept anonymization if re-identification is unlikely or the risks are remote. France and Finland are guided by stricter de-identification standards according to the European Data Protection Board guidance under GDPR. In Finland, only aggregate data is freely available to the public, whereas all other forms of personal data, including pseudonymized data, are available only in a secure user environment and subject to contractual restrictions. The UK has historically taken the position that de-identification risk can be remote, but may be aligning more closely with the EDPB guidance. Under US law, data that is de-identified under the HIPAA privacy rule is no longer considered protected health information and is thus not subject to any restrictions. This is the case where health information does not identify and there is no reasonable basis to believe that it can be used to re-identify an individual patient. A risk analysis for re-identification and metrics to evaluate the strength of pseudonymization are not readily available as far as I know. And I think that this is something that if we could provide in future or extend more research to, that would be mostly beneficial to many members of ethics boards. Several additional safeguards in these legal frameworks include in England and Finland, where researchers must execute a data sharing agreement and comply with information governance protocols. In the US, in contrast—
Limor, we are getting to the end of the session, so.
Yeah, so I'm gonna jump to the end. Thank you for the reminder. And just mention the fact that another problem is the fact that cross-border data transfers have been problematic in data protection space even before, and recently after the Court of Justice decision in Schrems 2 have been even more problematic. So assuming that we wish to collaborate on health data research projects between nations, we need to also account for problems like data localization. In these frameworks, we found that both Australia and Israel and India have data localization requirements for these types of projects, which potentially may interfere with international collaboration. So to sum up, very complicated space. It was a challenging work. We found that there are commonalities, but there are also quite a few divergences and also ambiguities, specifically in the processes for ethics boards, the de-identification definitions and models, and the data localization and transported data flows issues. So thank you, and happy to answer if there's 2 minutes for questions.
Yeah, there's a question from Everett. I heard complaints from industry that the anonymization requirements under GDPR are too strict compared to US law. As a consequence, AI development will stay behind in EU. Do you agree?
Well, at least from our finding, that is true. The US current requirement for anonymizations are lower than the ones of the GDPR. I think that there needs to be a distinction between the GDPR itself and these national frameworks, because what I came to the conclusion is that GDPR as a general data protection framework is not enough, is not nuanced enough and not specific enough for the use case of health data research. And since we now have these national frameworks that can work together and under the GDPR, I think that the key is in starting to use those legislation innovations and being able to overcome that. I'm also aware of the fact that in the US, there's a open consultation on updating and upgrading the HIPAA and thereby also taking the weaker anonymization requirements of the US legislation into today's requirements.
Thank you. Are there any questions from one of the panelists?
Well, I have more of a curious question about whether you think that the future of personalized medicine and people's incentives to enjoy some of the benefits of these large-scale research projects and that are dependent on this, even if anonymized, very personalized, but aggregated data will change something in public perception and eventually also regulation. And so it's more of a prophecy than an analysis, but as we now learn more about the importance of or the potential of personalized medicine, I wonder if you think that will change something in the regulatory landscape.
Good question. It really depends, I think, on so many variables on a geopolitical level that it's too limiting to think about it only from the perspective of data protection. But I actually don't think I can give any prediction. I think I mostly found this space very, very complicated and demanding. I think that maybe this year and the COVID experience would push governments into being more flex with allowing the sharing of data, but I think it's too soon to tell.
Okay, so thank you very much to all our panelists. And we now have a 15 minutes break for coffee. And then we return for the keynote lecture from Frank Pasquale, which will start at 5:30. So thank you very much, everyone. And I hope to see you again in 15 minutes.
Coffee is provided or we need to get our own?
Yeah, coffee is provided, free.
You can get a recipe.
Okay, so thank you very much, everyone.